To the computer. Brilliant. Okay, hello everyone. My name is Rob Horton. Welcome to the Tumble Hub, and today I am very pleased to be joined by Beth Shum. Beth, how are you doing?
I'm very well. Thank you so much for inviting me. Like I said, I was just so excited to share about injuries, adaptations, and answer everyone's questions as a physiotherapist. Like, what do you like? How can we make cheer better sports and actually treat cheerleaders like professional athletes and bring the sport medicine into cheer? So
Absolutely.
excited.
No, it's going to be good, and we've been planning this for over a month, so I'm really excited to have you on. But before we start talking about the main topic, I guess, why don't you tell us a little bit about yourself because you are the cheer physio, so it would be interesting to hear about all things cheer physio, Beth Shum.
Yeah, so like most cheerleaders, we're a bit like passionate and nerdy about cheer. So I was one of them. I've started cheer at 12 and I used to do gymnastics. I used to cheer in Asia and Hong Kong, and then I cheered in the UK nationally and like All Star and university, all that stuff. And I qualified as a physio. And when I qualified as physio, I really wanted to bring like sports science into cheerleading because I have knee injuries. I've sprained my elbow during like backhand sprain. I tore my ACL a few times. I had a concussion, and there was just nothing out there that I can find in terms of guidelines. And even the advice that's given by the hospital was very generic, saying, like, don't do anything for like 6 to 8 weeks. And then I was so frustrated because I'm like, I want to train, I want to be a part of the club, the community. I don't want to just do nothing because that's really hard. So anyway, one thing led to the other. I started doing a little bit of help with like Paracheer England, and now I am on the medical board for Spot Cheer England as an advisor. But outside of that, I'm a physiotherapist, the cheer physio, and I actually treat artistic athletes. So my main job is treating cheerleaders, circus acrobats. I work with the National Centre of Circus Art in London, and I also treat a bit of musician and dancer as well, but loads of acrobatic sports. So I would just he basically we just really want to share like how, as a physio perspective, how can we improve the athlete's longevity and health in cheerleading? It's something I'm really passionate about.
So you're not busy, you're not that busy then, no?
Mm.
But I
My
think
diary is pretty colorful, I shall say, but I like to do the combination of like educational work and clinical work because I think they go really nicely hand in hand. Every time I do educational work or like workshops or screenings, it gets me thinking about like what's the latest research? What is the science saying? How can we get better quicker with ACL knee injuries? How can we get better with ankle injury? And then the clinical stuff really helps me to like kind of weave it together. So I'm really grateful that I get to do something that I love.
yeah,
And the only downside is I don't think I can. I love to train more, but that's like the downside, the work-life balance.
100%. I think one of the things that you said when you were introducing yourself about being frustrated because you still wanted to train, but also you missed being part of the community, and that's really hard when you have a team sport like cheerleading because being there is very much part of the lifeblood of being a cheerleader. Being a cheerleader is great, but being part of a cheer team is just as good, if not better, you know? And so I suppose that kind of segues us into the main topic of what we're going to be talking about today. Um, Injury adaptation. You're an athlete, you love cheerleading. You've been told, like you said, oh, you've got a wrist injury, you're out for 6 to 8 weeks, don't do anything for 6 to 8 weeks. That's heartbreaking. That's a nationals miss. That's a chance miss to get on the plane or whatever it is. So how can athletes still train even though the advice has been no training at all for 6 to 8 weeks?
Yeah, I think that it's a really, the way you phrase it is really, really nicely phrased because it's such a big impact, isn't it, on someone's physical and emotional health. And when that happens, I always want to think about what's in our control. Because if you have an injury, you torn something like a ligament or a muscle, that is not in your control anymore because you have to let your body heal. But what's in your control is how you look at the injury and how you deal with it differently, how you approach it, how you communicate it, and how you optimize your healing. And all of those things are changeable. And then when you look at it, kind of shift your mindset to like, okay, I can't change it. I have an injury, but these are all the things that I can change. So let's list them all out and see where can I start. And that's when the adaptation comes in. as even with an injury, like our body's constantly changing, so you're healing. So at different phases of healing, you can do different things. So in the initial phase of the healing, you most people know that you have to like ice protect, elevate it. But as long as you got the medical clearance, movement is actually the best for enhancing the healing. And there's also research saying around mindset. If you have a positive mindset, if you eat well, you sleep well, all of those can make you heal faster and quicker. So if you can address those, fabulous. And then the other part you've asked about is around the adaptations. So then that is what we call in medical kind of sports science around load management. So if you normally can lift that much weight, like here, just let's say something like really, really heavy, and when you have an injury, how much you can lift drops here. But if
Mhm.
you are thinking about 6 weeks of not lifting anything because you're so scared of re-injuring again, or the doctors say no, your lifting capacity, you're going to get deconditioned, gone down to here. So by the time 6 weeks comes, originally you're here, then you're here, then you'd be like, why is it so hard to go back to the skills I'm doing? Because you're already weaker and deconditioned. So what you want to adapt is when you have that injury, when the capacity is lower, you want to start building the capacity week by week. So by the time 6 week comes, the space between your injury site and your original injury, it's a lot smaller. Then you can get back to training much quicker and back to your kind of skill set much quicker. Does that make sense so far, the concept of it?
Yeah, it does because it's one of those things, isn't it, where if an athlete is out for such a long time, by the time they come back, if they've been out for
Yeah.
6 to 8 weeks, it might take another 6 to 8 weeks for them to get back to some sort of optimal
Mm.
performance again. Whereas,
Hmm.
like with you're saying, with the load management and slowly building the capacity back up, so that by the time they get back into the gym, they're at least closer to what their form was
Not
before they got injured.
better.
Better. Well, injury, well, that's the thing, isn't it? When you injure yourself, you should be trying to improve that
Yeah.
muscle to the point where it's an enhancement on what it was before the injury anyway. But I think that's one of the things that we miss as cheer coaches as well, isn't it? That we think, okay, we have to respect these wishes because they are the doctor's orders or, whatever the doctor has
Yeah,
signed
yeah.
off. But then our team might be 3 months without a main base.
Yeah.
And then they've got to compete, and that main base hasn't done anything sort of any hard loading for,
Yeah. For
you
six
know,
to 8 weeks or even 12
for a
sometimes.
year. And then
Yeah.
what do you do after that? So, um, could you maybe talk us through ways that an athlete could then do that? I know that you've spoken about, the levels and stuff, but let's just say, for example, let's take knees and ankles really quickly, because I know we were going to talk about those anyway, but it probably makes
Yeah.
sense to talk about them now.
Yeah. So knees and ankles is really common for especially tumbling athletes. I think flyers, if they step down, they might sprain their ankles. But for people who tumble, sometimes you land with like locked knees or when you've like landed with knee extended and then kind of concave in that position, that can
Mhm.
cause a knee injury. And ankles, often people roll their ankles and then they get like ATFL, ligament sprain injuries around that. So let's just tr say injury, for example, because I can go into like kind of stress fracture side of things, but then that's a different management approach. But let's just focus on ligament sprain because that's probably the easier
Most
one
common, yeah.
and also most common ones that people get. So when we think about load, it's anything that you're going to push through the body. So there's load in the training and outside of training. And to build muscle strength, you need to overload it and then build it. I think one thing that kind of performing arts medicine and like in circus or the dance world and like because I do like West End stuff as well, that does really well is having a very clear weekly step-by-step approach for how do you like start building that load so then you don't decondition. And I think that's kind of something that's missing in cheer that we're trying to create, be like a protocol or step-by-step guide. And
Mhm.
what that guide will look like, it's often start with the lowest loading to highest loading. So ankles, for example, the lowest loading could just be like walking. Like, can you kind of walk more or walk less, depending on how swollen the ankle is? So that's like the initial phase.
Mhm.
And then steps, like if you want to increase the load, you could go like doing step up and step down. That is changing the load in itself.
Mhm.
So stepping down often has a bit more load because if you think about your body weight and gravity, even just practice stepping down, that is increasing the load.
Mhm.
Things like heel raises and standing on one leg, increasing time on one leg. Again, all of those are loading into the ankles, improving like ankle proprioception. But it may be in the initial phases, you're going to do loads of what we call closed chain exercises where your feet, it's on the floor. So standing on one leg, your feet's on the floor, heel raises, your feet's on the floor, stepping on and off a box, your feet's on the floor. So these are still loading exercises, but then there's no weight on it. And then the other thing that I kind of like to use a lot is around like resistant band stuff. I know some gym has it, or this is more like physio specific, depending on like your ankle, like which direction it's sprained, there's going to be a specific range of motion that's going to be weaker. So often, I'm just kind of generically saying,
Yeah.
it's the inversion injury. So the ankles go inwards like that, and then the ligament outside will get torn. So this motion is going to be a lot weaker than kind of that pushing out motion. So if you can work on stability on that range at the first kind of 2 weeks of the injury, that's going to help you to like, prevent some of that decondition. And then I kind of moved on to like harder stuff. I know I can get into more like jumping stuff, but even on jumping on a box, you can have like jumping really high, like on a trampoline. That's like really high load exercise comparing to like box jumps, where just jumping off the tumble drills and tumble spot or jumping on the spot. So that is another kind of step-by-step approach to increasing load. So you've gone from feet on the floor, everything is closed chain to a bit of open chain where you are kind of hopping on the spot, jumping on and off box, maybe a lower box to start with, jumping on and off uneven surfaces, kind of the medium load, and then to the higher load where you're jumping off a taller box, or you are using a holding weights while doing the jumps, or
Mhm.
moving your feet in like wider angle, multi-directional jumps. So then you have kind of things that you can do to make the exercise a little bit harder each week. So by the time you get to return to your training phase, your ankles and your knees are strong enough.
Yeah.
So I said that really quickly. I'm just trying to summarize like a whole kind of rehab plan in like 5 minutes.
Well, I know because you did a great job because we sort of discussed about trying to keep this under an hour, and that could have been an hour discussion on itself. So you did a great job there. I think in terms of just sorry, I was making notes. The in terms of coming back a little bit, we talked about injury adaptation. We it's very hard to train injury prevention in cheerleading. And I suppose that one of the arguments I would make for that is we should all be doing it and we all know we should be doing it. But a lot of our teams might train for an hour and a half a week, or they might train for a total amount of 3 hours a week. When you compare that to things like elite in gymnastics, where people are training for maybe 16 hours upwards a week, it's very difficult to kind of factor that into training. Would uh, would good prevention exercises for something like this be adding a, a plyometric element to your warm-ups or something like that? Or would that be a good way to go about it to kind of foresee?
Oh yeah, absolutely. I think from your experience, I think it actually cheer warmer has gone so much better since when I started, when we were just like trialing things out and testing it. Because I started cheer like a long time ago before it's kind of like this crazy high level. I think people have got a lot better to doing more dynamic stuff in a warm up. I think the easiest way to implement kind of conditioning is maybe at the end of the session where everyone's a bit fatigued and then
Mhm,
kind of push that extra bit of that load if time allows.
mhm,
Or if someone's really wants to kind of look after themselves, I think there's kind of a huge role of conditioning program outside of training. Because if you only do like one session an hour and a half a week, that's not going to be enough to maintain. If you're doing high level stuff, that's not going to be enough to prevent you from injury because you're lifting really heavy people if you're a base.
mhm.
And if you're a flyer, you still need to have a lot of kind of core awareness and foundational strength to kind of keep your cardiovascular fitness and like the muscular strength side of things to prevent injury. So in the ideal world, you do want people to do cross training across to for injury prevention. There's no research in cheer yet. If you find it, let me know. But in dance science, every kind of dance training that you do, you should do 20% of cross training. So that's actually quite a lot. So every 10 hours, that 2 hours should be cross training.
Mhm.
So if you're doing like 3 hours of cheer, you'd be doing a lot more kind of injury prevention stuff. You really should be doing a lot more outside to prevent injury. Because we know injury is not preventable, but if you can optimize your strength, you're less likely, way less likely to get injured.
I think so. I mean,
Especially the hypermobile ones. Some kids are like crazy bendy.
Oh my gosh, yeah. And those ones, trying to teach those guys the back handsprings when they literally just folding half backwards.
Yeah.
Like the flexibility needs to be in your shoulders, not in your lumbar spine. Like
Yeah, yeah.
so, um, yeah, no, but 20% is. I suppose I shouldn't be surprised that it's 20%. But when you factor it in, like you said, for a 3 hour training session, that's a long time to not be doing cheerleading per se, you
Yeah,
know. And so
exactly.
it is because so at Ascension Eagles, we spend a lot of time on our warm up or our warm, but our warm up is kind of
But
almost.
warm up is not the same as cross training.
No, well, this is what I mean. So, like, this is kind of where I feel like I'm stuck. We've almost kind of maybe need to have a rethink because
Mm.
we spend half an hour on our warm up, but
Yeah.
our warm up is cheer specific and not
Yeah.
necessarily body
Yeah,
specific.
yeah,
Maybe
yeah.
that's something that we need to be considering as
Mm.
well.
Yeah, yeah. But I think again, it's a really kind of difficult conversation because you have an hour and a half. You want to utilize your warm up to get your cardio fast. Like the main thing about warm up is about warming up your heart rate and getting like your respiratory up so you're like exercise ready and also mobilizing the joint.
Yeah, it's
So
like a
to be
dynamic warm
cheer
up.
specific,
Yeah.
it's really, really important as well because you want to be warming up the stuff that you'll be doing.
Mhm.
So I think that's the challenge is you can add in one or two kind of prehab videos because it overlaps with the cheer specific ones. But if we're talking about 20%, 60 minutes is like 12 minutes per hour.
Mhm.
So that's a lot. That's like nearly, let's just round it down to 10 minutes. So that's like 10 minutes per hour. So if you do 2 hours training session, 20 minutes should be like conditioning. I think
Mhm.
gymnastics do that because a lot of gymnastic club do kind of implement that conditioning stuff.
Yeah.
But in cheer, it's just so hard because there's so many elements to it. There's like the tumbling element and there's like the dance element. And then by the time you go through all of it, then you're like, where's my extra 10, 15 minutes of conditioning or prehab stuff?
Yeah, I always feel like we kind of start off with this determination at the beginning of the season. We will always make sure we condition at the end of practice and whatever. And
Yeah.
it'll be like we're gonna do
But the
burpees,
club
we're gonna do
that
push-ups.
does is gonna be the club that's the strongest by the end of the season.
Absolutely. But it's also the part where I think it's easiest to be like, "Oh, we've really got to finish the pyramid.
Yeah.
And it's like, and so you're kind of like trying to budget your time and you're like, "Oh, we're gonna have to miss the push-ups today, like, and so we end up actually missing really important opportunities to build
Mhm.
stronger athletes and then because they've done all of that strength
Yeah.
training, they have greater endurance to then do the things that we need them to do for longer. And it's kind of
Yeah.
like a catch-22 where the snake's eating its own tail, isn't it? And so,
It is. So
um,
I think that's why, like, if people are truly motivated and want the best, they should allocate time outside. Like the flyers, you always have flyers to stretch outside of training session. Why wouldn't you do the same for bases, for conditioning and injury prevention, and for the tumblers as well?
yeah. Okay. Right. What do you want to do here, Beth? Because we can go into the questions here, or we can talk a little bit longer about injury adaptation. Where would you like to go? Because I've got
About the
quite a few
questions,
questions.
because you've got quite a few people who've actually asked the questions, and then we can yeah,
Okay.
actually answer what people wants to know. Because
Right. I'll start
otherwise
with
we can keep talking for an hour.
No, no, yeah. I'll start with some of the more generic ones, and then we'll go into we can answer the more generic ones quickly, and then we can spend some time on the more meatier questions. Um, as a recommendation, this one is one that I hear all the time. But how many full outs are you recommending per session? What do you
Ah,
recommend?
I don't want to like say a yes. I don't think there's a right answer
Okay.
to that. I think it depends on age makes a difference because of the capacity to focus and the level of the team makes a difference. And also, I think with regard to full out, it's more around planning the full out throughout the year to build. It's similar to kind of like load management. You wouldn't want to be doing no full outs and then suddenly the week before com doing like 5, 10 full outs just non-stop in in the
Yeah.
session. So it's more about like gradually building it in. So if you're going to work it, the way that I'm very logical in terms of how I structure things.
Yeah.
So I think some people might not be, but this is how my brain works. So if I know there's a competition at like this day and that day, And the aim is to get 2 to 3 full outs back to back, so to get the conditioning up before that competition weekend, just to know that they can kind of just execute it all the time. Then I would start planning the week before, and then the week before, and the week before. So it might look like one mark through, one full out, one mark through. So like that kind of that pacing ratio,
Mhm.
and then into 2 full outs, one mark through, or one mark through, 2 full outs, and then maybe 2 full outs, one mark through, 2 full outs. So then by the time, so what are we on a week? And then the week after might be like, and then you can go into that back-to-back full out. So
Mhm.
it's kind of like that graded approach, but be really like mindful of it because I think it's so easy for us to just say, let's just do full out this session. But
Mhm.
if you're like, actually, this is about kind of progressive loading. So 4 week before comp, we are doing like one rest, one mark, one rest and mark, and then the week after we'll be doing like two maybe 2 full out, one mark through, and then the week after you're doing three, then that's a more sustainable way to do it. And then the other approach you can do is about break. I think some coaches do that as well, breaking up like the sessions of, okay, in this mark through we're only going to do tumble, and in this mark through we're only going to do stunts, and in this mark through you're only going to do da 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 da. And then so you build up kind of that stamina by the end of it, but rather than like just do it full out from the get-go. That's just my opinion, but I don't think there's right or wrong at all.
Okay. But
What are
but
your thoughts, Rob? Because you've been coaching way longer than I do.
there was no need to go there, was there? Um, I think one of the things that we like to do is we so the final 2 weeks before competition, we like to put them into kind of like the competition mindset. So when we're in the final 2 weeks, we use whatever the floor time is given to you as part of your warm up, and then we use that as our build up into competition runs. So for example, we might start, let's say it's 8 minutes on the dead floor, 8 minutes on the sprung floor, 5 minutes waiting compete.
Yeah,
We
yeah,
might do that as we would like to try and embed that maybe twice as
yeah.
part of our
That's
practices.
fantastic,
In
especially for the one who's not competed before.
Yeah, but then they go into the competition
They
with the
know
kind
what
of
to
like,
expect.
yeah, they know what to expect. There's no surprises other than the lights and the things that are going to cause anxiety anyway. But at least there's a familiarity in, oh, I know what I do here. And so, we do our stretch and our stunts on the 8 minutes dead floor. When we go on to the sprung floor, we know that we've got 4 minutes max to run our tumbles, and then it's full out cheese pyramid run um, with um, with jumps, and that might be the way that we do our warm up, so that when we go onto the floor, they can go out and have the best run possible. But it also allows us time on each floor to cover any issues that we might have. But then in the build up to those final 2 weeks, we might be dealing with any fires and then build them up to a couple of run throughs, a practice or whatever. We don't tend to do um, more than 2 to 3 full outs a session. I know there are teams that do more
That
and,
do that.
and that
Mm.
works for them, and that's great. For us, that is not something that we generally do with our
Mhm.
athletes. And like you said, when we are doing things, we might have a pyramid run, or we might have a stunt one run, or we
Yeah,
might
yeah,
have one team, one stunt group
yeah,
goes, and everyone else has to cheer for that one
yeah,
stunt group, and
yeah.
they will be how we build our endurance, but also how we build the mat talk to
Mm,
get athletes to, because I mean I know that's kind of, I'm kind of moving away now from
yeah, number.
and stuff, but just in terms of trying to make people feel good and confident can be the difference between getting an injury and a not, because someone might not fall or whatever. So I
Yeah.
think there's that's generally how we build up for our full outs, and it works for us. And I think being able to train the competition schedule makes a massive difference.
I think that's actually really, really good. I think, well, if anything, more people should kind of use that kind of approach because I remember sometimes when you're in the competition, your brain just forgets like what's normal is, right? But if
Mm.
you start to drill them of this is what it's going to be like, then you're kind of priming the mindset, be like, I'm going to only have this much time in the warm-up section,
Yeah.
and then how much time on the mat because. And I also kind of question like what is the need for doing more than kind of 3 to 4 full outs in a session?
Mhm.
Because I mean full out takes time and you need recovery time after as well.
Mhm.
And if you in competition, if you're only going to do it once and you're now pushing athletes to do it kind of more than kind of 3 to 5 times, the thing is like how much benefit are you going to add apart from you're overloading to fatigue? And
Mhm.
then maybe that full out in the cell can increase risk of injury because you're pushing them over
Yeah.
and over again.
I can even hear myself saying, I can remember myself saying to athletes after a session where it's been quite tough. And like I said, we don't generally do more than three full outs in a session, right?
Yeah,
And there'll
yeah,
be
yeah.
arguments for or against that, but I can hear myself at the end of sessions going, look, guys, I know you're tired, but you are not going to be this tired on the day. Like I promise you,
Yeah,
because it's one and done on the day. So we're trying to build your endurance and your resilience here,
exactly.
but you're not going to be this tired on the day. You're going to be too excited for a start. You're going to be too
Yeah,
anxious.
you have more energy, if anything, more bouncy.
Yeah. So that's generally yeah, that's generally our approach, and it works well for us.
Yeah,
So yeah.
yeah. I think given the time you've got, and like I said, I think part of the problem is we're not the skills that we're doing is so high level, but most people are not training enough to meet that demand. That's how I see it. And it's really hard because you want to push the skills there, but then there's only maybe a small group of people who has that kind of baseline condition that can do kind of that amount of skill set. And you
Yeah.
might find what I used to notice that people who kind of train other things alongside cheer, they often progress a bit faster.
Yeah. I was also going to say that I think the athletes that transfer from sports like gymnastics into cheerleading,
Yeah.
you can see that they've done gymnastics. And I think that, and I don't think that's a criticism, that's not a criticism of cheerleading. I think that's more of an observation of time.
Yeah.
Because if you come into cheerleading, you've already got a round off flick full twisting layout for
Oh
argument's sake.
yeah. Yeah.
You've been
You
in the
know
gym
what is
for a
it
long
like to
time.
compete? You know what is it like to train and put in the
Yeah.
hard work?
Yeah. And so I think, those athletes, they come in and they're cheerleading superstars and fair play to them. But actually, you also have to take into account that their training regime
Yeah, yeah.
has
And the
been.
hours they put in outside.
Yeah, and also cheerleading and gymnastics is in a lot of cases an individual sport. So it's
Yeah.
about that kind of individual excelling over other
Mhm.
people, and it's a
Yeah, the
different kind of
team.
competitive nature, isn't it? So I think there might be that as well. That was meant to be the short question. I'm gonna move on. We've kind of already spoken about specific recommendations for warm up and conditioning. Warm ups are meant to be a little bit more dynamic, and
Yeah,
you could then conditioning at the end of a session is meant to be a little bit more sort of about loading and increasing
yeah.
those loads. But let's talk about athletes whose main role is a tumbler,
Hmm.
right? How do we build endurance for them during full outs? Now, obviously, we work on the basis that it might be 2 to 3 full outs a session, but other teams and programs might be doing more. So, if your sole role is to bring tumble ratio to your team, how can you build endurance for full outs so that you are more successful and you're not causing deductions?
Hmm. I think it's really hard because tumbling in itself is such a tiring and power move,
Hmm.
isn't it? So I always think about where does the power comes from and when does the endurance comes from? So the endurance comes from cardiovascular, like how good your cardiovascular health, and the power comes from the ability for your muscle to produce force. So
Hmm.
there's a few key muscle groups that produce more force than others. Often it's the bigger ones. And when it comes to tumbling, what I've got a few ideas. What do you think? I'm just kind of curious whether we're on the same track. What do you think would be the key muscle group that produce power in the legs?
Oh, well, for me, when a lot of the time that I'm teaching, so if I'm teaching sort of, for example, around, well, I'm obsessed with the hips and the glutes, to be honest, right? So the hips and the glutes are like my it sounds so bad. They're like my sole obsession when I'm coaching. Like the amount of times I say you have to lift your glutes or you have to squeeze your bum or I'm getting kids to lay on the floor and I'm picking them up by their ankles and going, look how tight you need to squeeze. Like, so I'm kind of obsessed with this middle area, the hamstrings. I spend my life talking about needle kicks and how they need to improve the power of their needle kicks. But that's me. You were smiling, so I feel like I'm on the right track. Talk me through it.
Yeah, so a lot of the like the power that comes from like a jump perspective is around kind of that low the power from the tumble comes from the lower limb. So the glute and the hamstrings are really helpful for power and also injury prevention because the glute will look about like three different areas. So the back of the glute, like the one that like the kind of the cheeks part, that's the extension of the hips. So because it's such a big muscle group comparing to kind of the deeper muscles in the hips. So you've got like six external rotators, and then you've got your glute max, and you've got a good min and medius on the side. Those are more for stability. But when we come to tumble, we need the power, and we need the power from the extension. And the extension of the hips comes from mainly the glute. And also a little bit of extension comes from the hamstring as well. So the hamstring attached to like the base of like the sacrum. It would be good to have some pictures, but like this is like your hips. So I'm just gonna stand up. So for the ones who's listening, they have to watch the video. So like, so this is like your gluteal muscles. It comes from your pelvis here all the way to there.
Hmm.
And when you sit down, you have like your sit bone, and which where this sit bone is, where your hamstring attach. The
Hmm.
hamstring extend and the extend the hips, and it also kind of flex in that knees as well. If we want more power in like tumbling or in runs, it all comes from the push from like that gluteal area
Yeah.
and the hips. So anything that's gonna help strengthening the posterior chain, we call it the glute, the hamstring, and also a bit of the calves as well.
Yeah.
Because that's all the posterior chain, which is like the back of the body,
Yeah.
that's gonna help drive that power and that yeah, kind of that power. And also hamstring is really important for like landing as well and the absorption. So you've got the power move and then the absorption side. So if you can train like more glute activation, so things like glute bridges with weights, fantastic.
Hmm.
Yeah, and also things like a little bit of like single leg RDLs and deadlifts. All of
Hmm.
them are like fantastic pre-happy stuff for tumblers. So you're on the right track.
Well, no, well,
And
like I said,
maybe a bit of calves as well. I think sometimes we forget about that. So
yeah.
calves has a lot of the outward force.
I feel very validated. So I spend a lot of the time. So once athletes are getting into their sort of like so for like for a back handspring, for example, um, when they set for their back handspring, we have the athletic position. They have to drive their arms to their ears, and
Yeah,
then they have to hit their arch shape. But to hit the arch shape, they have to stand up super fast. And
yes,
athletes don't stand up very fast when they're
yeah,
trying to learn a back handspring because
yeah,
their first thought is I need to get my hands to the floor, and then
yeah.
because they don't
And
jump
if
properly.
you're not in that fully extended arch position, you're losing power just
Yeah,
by because you lost the line, and then that center of gravity becomes lower. If your
absolutely.
center of gravity is lower, your body is going to be heavier. Then you have to push more. But if your center of gravity is higher when you're doing a back handspring, you're more likely to
This
get.
is the conversation I had before, actually. So, female athletes tend to have their center of gravity in the hips, and male athletes tend to have their center of gravity in the shoulders. And that's where
Shoulders. This is
males
so
rotate
good.
better at the shoulders because they're broader, and females rotate at the hips because they tend to be broader at the hips. And so, I spend my life speaking to these athletes. I'm saying, look, you need to stand up. Otherwise, this is not going to work. So you
Yeah,
need to make sure. And you talked about the calves and as well. And so when athletes are setting for their back handspring, for argument's sake, I'm like, you need to push through your toes because that is where you are going to get the full extension of your body. And so,
yeah,
but trying to get them to understand that as well. And I know that we mentioned we were going to talk a little bit about drills. So, for example, as a tumble coach, when I set up a circuit, I set up a circuit that's going to tell the story of the skill. So we have
mhm,
like the set, we have the moment of engagement, and they're starting to
yeah,
get their
yeah,
arms to their ears, the arch position, the
yeah,
block position, and
yeah.
all those things, so that we can kind of jigsaw piece this skill.
You know what's interesting as you're talking about the jigsaw? You know, what you're doing essentially is so similar to physio, it's just to a different context.
Okay.
Because what physio does is break down what like the pieces of the Lego that require to get that end result,
Hmm.
whether it's jumping or running or cheerleading. But
Yeah.
what you're doing is breaking down the skill set for what you needed to get the end result, back handspring, round or back handspring, back tucks, and what are like the each stages of it. And I just thought that was really brilliant. Sorry, I just have to say.
So what you're
It's-
saying is that I could be a physio.
You can be a physio.
Get in there. All right. Okay. Um, So brilliant. We're on the same track there. Athletes whose main role is tumbling, make sure that we are working on their hips and their glutes that they can create power. They're already working cardio all the time anyway, but just to make sure that we are building up them up in the middle, particularly so that they can be strong and they can they
Yeah.
can endure. All right. Okay, I think I've got two more questions for you. The last one of them I'm going to save. I'm going to ask you about wrist first. An athlete, I put that I was going to be speaking to you today on my Instagram page, questions for Beth, and athlete sent me in a question, and the question was, I have weak wrists. Help me.
Oh, Oh, wrist, hey. It's also like a bit of the bane of my life because I see so much people who do hand balancing and aerial with wrist problems because tumbling and cheer, there's so much load through the wrists. So
Yeah.
you've gone from suddenly not putting normally you might load your wrist, you're holding a kettle, you're holding a cup, it's nothing heavy, and then suddenly you go like, oh, let's go and do some round off and backhand springs and lift people in the air. Your wrist is going to full extension and you load in for extension. So there's loads of like kind of rehabby, prehabby drills you can do to strengthen the wrist. But when I work on the wrist, I always also work on the shoulders as well
Oh,
because your body interlinks. So if your shoulder is stronger, you're gonna get less load on the wrist. And it's often sometimes a bit easier to kind of get your shoulder stronger faster than the wrist because shoulder has more kind of bigger muscles that can produce more stability. Whereas the wrist, you've got your wrist flexors and extensor muscles, and that's about it. And wrist pain, that can be another hour in itself because there's so many reasons why people get wrist pain. Most common in gymnastics, you get, I'll just list a few of the conditions that you might see. Some people get tennis elbow and golfer's elbow, so like pain on the lateral outside of the forearm because you're always in the extension, end of range loading, so much rotation, so overloading causing pain because the muscles that move this comes from here. So that's an overloading injury. But you might also get the tumblers. Some people get some swelling and maybe like they call it like gymnastic wrists or TFCC,
mhm.
which is a small kind of a structure around here where it gets kind of torn or injured and it gets swollen, and that can really affect pain and range of motion. And then so that's one thing that's it can be really hard to treat because in our hands and the wrist does a few motion. It flex, it extends, it ulnar deviates as well, it supinates a little bit. But the movement that does that, it's really like just ulnar deviation. It's kind of just like there's this one really small muscle that does it. And then the circulations here is not the best because it's quite a small structure. There's eight little bones here, and it's hard to get that loading into this position. So when people get like TFCC problems, it can take ages to get better because it's so hard to load it correctly. So if you have wrist pain that doesn't go away, I think it's better to actually get assessed and to figure out which is the issue because it could be here and it could be from the joint where you have a cyst, where prolonged overloading, if people have a lump there, you might have a cyst, and that cyst can get inflamed, and then you need medical treatment for that. Or if you land it on outstretched hands and you start to get swelling here, I would say with the wrist, if you have an injury, like an acute one, you just landed, it got swollen quite quickly, especially in what we call the anatomical sniff box, this area. We can see with two tendon here. If you don't see the tendon, go to your A&E because it might not be a simple sprain. There's a risk of a scaphoid fracture, which often get missed because it's a very small bone. Uh,
Got me
yeah,
worried.
it's an
Thanks.
interesting name. They call it the anatomical sniff box because if you lift the thumbs up, you can see there's like a box here.
I've
And I
only
don't know
got
whether
one.
it's from like this.
Where's
Yeah.
my
So
other
this,
one? Is it there?
yeah. So can
Oh,
you
it's
see
there.
the thumbs? And then there's this two ligaments that creates like a dip. Yeah.
Oh,
Underneath
oh
it.
yeah,
Yeah.
I can see it.
There. Yeah. So if you have swelling there from a fall, I think that's like a straight away A&E sort of thing. But if it's just generic wrist pain that doesn't go away, then it's trying to understand whether you get pain when you're training or pain after training. Because pain during training, pain after training is a different kind of load management thing. So, because if it's pain during training, then it's kind of a bit more serious. But if it's pain after training,
Hmm.
not saying it's not serious, but like you should do some strengthening work for it so that you can start loading that so to get that stronger. Um, and I see a lot of people use tape around the wrist as well. So if you're quite weak and you have a bit of like quite a mobile kind of wrist, then it is helpful sometimes to put tape around it, just a single oxide tape or like the TFCC tape where there's like kind of this two black strap you see in gymnastics sometimes like that. Sometimes that can be helpful, but don't think that replaces rehab and strengthening work. Yeah, so that was a lot of information. Again, I tried to like dump it down in 5 minutes.
You
Be
did
like,
great.
this is the serious stuff. Go get help. If you
Yeah.
have this, try and get it stronger. If it doesn't work, get help.
Okay.
But get strong in your shoulder and wrist.
Sure. Yeah, well, I've made a note of that, wrists and shoulders, and I'm definitely going to be thinking about that. Right. last question before we finish, and you can tell us a little bit more about what you do or your services, sorry. Um, I thought this question was great, and so hopefully you can cram it into 5 minutes. But trends in injuries over the past few years and why? I just thought it was a brilliant question. So,
Yeah,
what you got?
I think that's a really good question. But a lot of the trends are, again, US data. There's a lot more, there's concussions and then there's kind of like sprains, and most injuries coming from fall. And again, this is from US data. So the more common cause of injury for cheerleading is from fall from heights. But in terms of what injury we see, I think concussion was one of them, and like sprains, ligamental injury, and then that's followed by some more kind of fracture side of things. So we don't actually get that much serious injury or like spinal cord stuff, but there's a lot of muscular, like sport injury related things. In terms of the area of the body, that has actually changed according to the data. But in terms of what I see in a kind of generic trend in cheerleading, you'll see a lot of like ankles and knees, I think, because of tumble. And you also
Yeah.
see shoulder stuff as well.
So would you say that's because of overuse, or would you say it's because people aren't landing correctly? Because
It's
I
really,
would say, well, I'm just interested because the landing correctly one is I see, when I'm watching people learn falls or when they're performing falls, and I'm like, "Oh, you're still spinning as you land. Like we've got to learn to spot the floor or whatever it is. So yeah,
yeah. I think it just depends because from my perspective, I'm always going to have a more skewed perspective purely because my reported injury is people who are more serious. So I'm going to see in clinic or people reach out to me more what we call acute injury. So that's more like people who land funny and then hurt themselves. But from a club perspective, and from me as an athlete perspective, I think there's actually more injuries under unreported or being people try to self-manage. And that can be more if you use injury because people can cope with it more. And people can kind of push through it more with a bit of like modalities like taping and icing and medication side of things. And masking something that's a bit more serious. So it's yeah, it's kind of like a hard one to know because the data is saying it's more accidents. But in reality, I don't know how that translate. Like, is there, yeah, does that make sense?
yeah,
Because there's no, every club will be different and there's no kind of data. But I do see in terms of area, ankle, knees, and shoulders.
always ankles, knees, and shoulders.
All the big joints, all the weight wearing joints.
The one, yeah, and the ones that are taking the most impact as well.
Yeah, absolutely. Yeah. If you think about the nature of what the sport does, then it all kind of makes sense, doesn't it? You're loading your shoulder in end of range, and then your knees are absorbing, your ankles are absorbing all the time.
Because especially with the shoulders, you're stretching while trying to build as well. So
Yeah.
you're trying to
Yeah.
create range, but you're also limiting range by building the
Yeah.
muscle on top, which is kind of like a catch-22, isn't it? So
Yeah.
you know,
And
to
you're a
that.
little bit more like internal rotation. And luckily, I don't think that's that many shoulder dislocation. I've seen a few, but that's not that many. So those are quite serious injuries. So when I've seen one where people are in extension and then the weight fell out and then the shoulder popped out. That's not very nice, at all. But I think because the nature of it, you're actually a little bit more close in, so your pecs are pulling in quite a lot. If anything, people just end up with quite tight pecs, and they're
Yeah.
quite strong there, but not necessarily like external rotation. So more strength here than there.
I think you find that a lot with the bases who struggle with like level one skills because
Mm,
they spend all their time kind of like here,
yeah.
and then all of a sudden you're like you got a back walk over, and they're like, I can only get my arms to here, like, and they're trying
Like
to,
I'm so used to here.
yeah,
And then my shoulder gets really tight that way. Because
yeah,
tumbling, back handspring is external rotation, but
yeah.
stunting, it's internal rotation.
100%. So cheerleading pulls all of it out of you.
It
Uh,
really does. Like,
well, Beth, that's all of the questions I've got. I mean, before we finish, would you like to just tell us a little bit more about the services that you provide alongside being the cheer physio? Just what you do and where people can look you up if they're interested in knowing a little bit more.
yeah, so the easiest way to look me up is on Instagram. It's the handle is at Flexibility Matters. I'm not as good on Facebook. So that's the faster ways to get response. But in terms of the services we offer, we actually started a new branch called the Cheer Physio because I've got so many requests from Flexibility Matters. So the Cheer Physio is kind of like a resource hub. We're building or with a sport medicine expert to create a bit of a resource hub to give you all the information that like we're talking about today. Return to training protocols. What is the sport science saying in terms of like training and loading and recovery and periodization. And we also offer one-to-one services in terms of for people who has injury. So if you have an injury, you want to speak to your physio who can give you a very specific rehab program. We do that in person in London and also virtually as well. And you'd be surprised how good like virtually things work too. We also do screenings for clubs, and that's something that we want to introduce for the start of next season. So there's a few things that's going on. So resources for if you just wanted to get to learn more about these things and how to implement in the gym. If you have an injury, come see us, but we also offer screenings for clubs if on request.
So, like you said, you're not busy at all, and you've got lots of spare time.
I do find these things really interesting, so like, I don't really get bored of learning more or putting it all together. And it's just tweaking from like what I do in circus as well, which is really nice.
Now, I can totally relate. I spend a lot of my time jumping between learning and looking at other tumble coaches and what they're doing or what other programs are doing and thinking, well, that's a great idea. Between doing all things tumble hub. So
Yeah. Because I
I,
think at the end of the day, you just want like it all goes back to like your why, like why you're doing this because you really care about it and it's really interesting and you want, to and help the athletes and watching them growing up and watching them develop is really, really rewarding. So it just I think it makes it easier for you to do all these different things because you really care about it.
I don't think I can sum it up any better than that. So I think we will finish there. Beth, thank you so much for giving me your time today. I've learned a load. I've been making notes. I made loads of notes. And I'm
It's
gonna be
thank you so much. I really enjoy it giving me like the space and a platform to just be nerdy about it, about sports science
it's
and
nice to
cheer.
meet other people out there who are as nerdy. So it's great. All right. Thank you very much, Beth. And oh, it'd be great to have you on again sometime.
Yeah, we should. You should come to my podcast. I'll have a bit of a plan.
Yes, get me on the podcast. I'm in. All right. Thank you very much, Beth.